A heart attack is an episode where the heart muscle isn't getting enough oxygen to it. When a patient is having a heart attack and not complaining of chest pain, the most common thing they complain of is shortness of breath and fatigue. It's a very typical story that someone will say to their spouse, "I'm feeling tired, run down," and they go to sleep and they never wake up because they're having a massive heart attack that then leads to them going into cardiac arrest.
We know that cardiac arrest is a big killer of people in the United States.
Cardiac arrest is a situation where the heart muscle is not pumping at all, and there's no perfusion throughout the entire body of blood because the heart muscle is not at all working to create a good blood pressure. Once a patient is in cardiac arrest, you need to start chest compressions immediately. The way we tell someone's in cardiac arrest is they're unconscious and unresponsive to stimuli. And so our messaging is to do chest compressions when you think someone's in cardiac arrest. It is much better to do chest compressions on someone who has a pulse than not to do chest compressions on someone who doesn't have a pulse.
The cases where people do well is when they're recognized, when they get bystander CPR, and they get access to a defibrillator, and they activate 911. If those pieces of the chain are in place, our survival rates can be over 30 to 40%, and in some places higher.
We have the possibility not just to save people who only have a few months to live, we have the possibility to save young people who have many years ahead, save them so that they can be more productive, and save them so that their families aren't losing someone before their time.